I started specializing in menopause about 28 years ago. I decided to get something at the level of expertise, and my practice was divinely guided in that direction anyway. And we started doing a lot of things. About 20 years ago, the compounding pharmacist that I had been using for years, instead of shipping the bi-est to my patient, shipped it to my office. And I had never seen a hormone. And it used to come in those white cosmetic jars. I was fascinated, and out comes this strong odor. And I've been a functional medicine doctor for over 50 years. And I investigated that odor, and I learned that the steroid hormones are very poorly soluble. And in order to get them up in a solution, we must use strong solvents. And that's what the compounding pharmacists have been doing. Strong solvents that have toxic potential. So I did the math. I'm asking women, by that time, over 10 years, to detoxify as a functional medicine doc. And I'm also asking them to add 1 quart a year of very strong solvent to their bodies. We did a lot of experimenting and trying and researching, and we came up with a way of dispensing these in organic oils. These are in certified organic oils, combination of jojoba, borage, and primrose. And we've got patents on them. We've really put in a tremendous amount of effort, tremendous amount of money, and got patents on anything dispensed in oil. We did studies with Eagle Lab to see, does it hyperconcentrate if you don't shake it enough? So we sent them a bottle of bi-est that's totally full, a bottle of bi-est that one of my patients had worked down to the dregs. We compared them, and they were within FDA guidelines of 7%. You don't want a difference there. They don't want it to be off 7% one way or the other, too rich or too not. And it was definitely within the guidelines. And that's when my life changed, because it wasn't hyperconcentrating. Suspensions worked beautifully. This is what we ship every new patient: a bottle of progesterone, 200 milligrams per milliliter, and a bottle of testosterone combined with DHEA. Because invariably, 90% of women that we're working with need testosterone right out of the gate.